everyone, and welcome to our ISPCAN webinar. My name is Jane Estes, and I'm the ISPCAN Knowledge and Content Development Manager and moderator for today's session. Also joining us is Holly Malcolm, the ISPCAN Membership and Marketing Manager, and she'll be engaging you in the chat box. ISPCAN International webinars are always free of charge and cover diverse topics which are presented by subject matter experts from around the globe. These 90-minute webinars are designed to help our members and partners gain access to knowledge and expertise to inform care, improve practice, and drive policy change. All this is critical to help improve the outcomes for children globally. And now I'm excited to introduce to you a new concept, ISPCAN's new training model, the huddle. If you're a practitioner working in child protection from any sector, then this special training is an incredible opportunity for you. ISPCAN will bring together multidisciplinary experts from diverse regions who will all examine a case study involving a different form of child abuse each year. Using this case study format, each discipline will evaluate the role that it played throughout the case, and they will come together to determine what could have been done differently to ensure a more successful collaborative response. Applications are now open for our first huddle, which will be in Denver, Colorado on March 24th through 26th. What we're focused on in this huddle is strengthening interdisciplinary strategies to address child sexual abuse. We'll get insights from the film Rewind by survivor Sasha Neulinger. Multi-generational child sexual abuse in the context of culture, family, and systems of care will be explored. How the medical, mental health, and justice systems interact to protect and heal the child will be deeply examined. From the eyes of the child, we'll hear the case as it unfolds using Sasha's home movies as he recreates and tells his story. And it's our honor to say that Sasha will be joining us in person in the huddle in Denver in March. What you see on your screen now are the multidisciplinary content experts who develop the curriculum and will lead the case study in Denver. Please visit our website for the full huddle concept note, the 3-day curriculum, and the application to attend. And we hope that we'll see you in Denver in March. And because we believe that you should have access to all the information and resources available to support you in your work, we encourage you to visit our ISPCAN Knowledge Hub. The Knowledge Hub is an open-access centralized library containing ISPCAN and impactful partner resources. If you have an open-access resource or program that you would like us to disseminate in the ISPCAN Knowledge Hub, please email it to me at partnerships@ispcan.org. And today's webinar is part of our November Public Health Prevention Campaign. ISPCAN international partners, country partners, and members around the world are taking action through the month of November, providing activism and support for professionals in all disciplines and in all countries through the sharing of educational webinars, cutting-edge resources, the latest data and research, impactful programs, and powerful infographics. We encourage you to visit our website and to join our campaign for the remaining days in November. And today is special. Today is the World Day for the Prevention of Child Abuse, which is observed globally on November 19th each year to serve as a crucial platform for raising awareness about the prevention of child abuse by advocating for all children's rights to safety and protection. Today underscores the importance of creating safe environments where children can thrive without fear of abuse or harm. And we at ISPCAN would like to sincerely thank everyone who's joined us today for the role that you play in protecting the world's children. And we are so thrilled that you're with us today. So I want to share some tips for making the most of today's session. Please engage with us. This session is meant to be an active, interactive learning platform. Please participate by sharing your comments in the chat and your questions in the Q&A box throughout the webinar. We'll use your questions to begin the Q&A session immediately at the conclusion of the presentation. Also, please take a moment now to introduce yourself to other attendees, our ISPCAN team, and our featured presenter in the chat box. Let us know where you're joining from and your organization and discipline. To enhance your experience, you may enable closed captioning from your Zoom control bar by choosing Captions. And for joining us today, a recording of the session, the panel discussion, the presentation slides, and links to the featured resources will be sent to you directly after the webinar. Our topic today, Effective Partners in Prevention, what you need to know about Family Resource Centers. Family Resource Centers are community or school-based welcoming hubs of support, services, and opportunities for families. These centers utilize an approach that is multi-generational, strength-based, and family-centered. They reflect and are responsive to community needs and interests in both rural and urban settings. They build communities of peer support for families to develop social connections that reduce isolation and stress. This webinar will chart the tremendous growth of family resource centers in multiple countries, illustrate the successful outcomes that they've achieved for children and families. Our key learning objectives for today's session are to gain an understanding of what family resource centers are and their key role in prevention, to review the data to understand the significant impact that FRCs have on the prevention of child abuse and neglect within the communities that they serve, and to understand how you can further explore FRC development in your communities, even with limited resources. And now to meet our presenter, Andrew Russo. Andrew co-founded the International Association of Family Support Networks in 2024. Previously, he served as the co-founder and director of the National Family Support Network in the United States for 13 years. He has worked and volunteered in the nonprofit social service sector at the direct service, management, and network levels for more than 25 years. Because of his keen interest in working collaboratively at all systems levels to ensure families are supported, Andrew co-founded and served as co-chair of 7 family support networks at the national and international levels. He has co-authored several landmark documents in the family support field, including the Standards of Quality for Family Strengthening and Support. And now it's my honor to turn the session over to Andrew. While he pulls up his information, we'd like to have you participate in a 2-question Zoom poll. So if you would like to answer these 2 questions, we would love to get feedback from you. I love the diversity of background coming in the poll. Thank you so much for participating. I'm going to give it just 1 more minute and then we'll close the poll. We can see the results. So Andrew, any key thoughts about the results of the poll? We've got great representation from the nonprofit NGO field, a lot of government, child welfare, and other government positions, 12% practitioners in our audience and social workers, educators, researchers, parent leaders, consultants, religious organizations. So again, tremendous diversity in our audience, which I think will speak very much to what Andrew's going to share with you. And then exciting at the levels of work, we have policy and system level at 41%, which again is a key part of FRCs and how to establish these in your regions. So thank you for participating. Again, I hope you see the diversity of audience and of really who is in the audience and what level that they can participate in learning more about FRCs. And Andrew, I'm going to turn it over to you now.
Thanks very much, Holly. Thank you for your kind introduction, and thank you to ISPCAN for the opportunity to present today about this very exciting topic about family resource centers. Wonderful to virtually meet everyone who's participating in this webinar and those of you who may be listening to it later as a recording. It's great to see through the poll that literally every category had somebody in it. So to Holly's point, we have a great diversity of folks here from around the world and great to connect with you. So today we'll be talking about family resource centers as effective partners in prevention and covering what you need to know about them. So our overview of our will include talking about family resource centers and then talking about how family resource centers are networked as well. And then we'll have our discussion with our question and answers and opportunities to explore the relevance of this content with your important work in the world. So this is our roadmap for our time together. And first, I'm going to start with talking about the history of family resource centers, first using the United States as an example, and then we'll turn to Ireland as an example. So, using the US just as one example of a country, the history of family resource centers goes back to the turn of the last century when immigrants were coming to the US in large numbers, primarily from Europe, and these settlement houses, like the image you see on the left, sprung up in large metropolitan areas to help those new immigrants to acclimate to and succeed with life in this new country. So they provided different kinds of support, such as English classes and job skills trainings, and information about how to navigate the new society that people found themselves in, as well as opportunities for people to preserve their home cultures. The image on the left comes from San Francisco and the Good Samaritan Settlement House. And the image on the right is the exact same location today, which is now the Good Samaritan Family Resource Center. And that Family Resource Center continues to work with a population that is largely immigrant, with now the immigrants coming primarily from Latin America. And many of the supports and services are exactly the same as over 100 years ago. So English classes and job skills training, although now that looks more like computer training and digital learning. And also many things we know now support people to succeed with a particular emphasis on families. So supporting families with the healthy development of themselves and their children. So the roots of this work in the US go back more than 100 years. And then looking at Ireland as another example of a country with the establishment of family resource centers, this dates back to 1994, which it doesn't seem like that. It doesn't seem so long ago to me, but is actually quite a while ago, that the UN had officially declared the International Year of the Family. And in Ireland, they decided that they were going to commit themselves to advancing the family by establishing family resource centers. So it started with a pilot of 3 centers that were opened by the Department of Social Welfare, and they had a particular focus on the community development side of the work, recognizing that there had been limited investments in community development and recognizing that supporting families' healthy development is a key part of that community development. So they started with 3 and quickly expanded to 10. Then in 1997, there was a report that evaluated the centers, talked about the great work that they were doing, and called for the establishment of more centers. Subsequently, more centers were established. The network across the country was established, which we'll talk about later. And by 2018, they were up to 121 family resource centers located all across the Emerald Isle. So these 2 examples give you some sense of the history of family resource centers in different countries. And this is the map of the Irish network. So you can see all across where the centers are. They're located in urban areas and rural areas and in between areas, working with all different kinds of families, both immigrant families and native Irish families. Right. So family resource centers may be community-based, like the image you see on the left from Ireland, or they may be school-based, like the image you see on the other corner of your screen, the right-hand corner of your screen, from Kentucky in the United States. So they may be community-based or they may be school-based. They may be in rural areas, like the image you see on the left from Colorado in the United States, or they may be urban, as the image you see on the right, which comes from Vancouver in British Columbia, Canada. They may focus on a particular population, like the image you see on the left that comes from Prince Edward Isle in Canada, focusing on the Indigenous First Nations community, or they may be broadly serving everyone who lives in a particular area, like the image you see on the right, which comes from Scott County, Minnesota, in the United States. So a lot of diversity with how FRCs are set up. But wherever they're set up, they're working with this unique approach. So this image comes from the Irish network, which is how they describe their work as being pinned in a human rights based approach, particularly the rights of the child, and wanting to ensure that children have healthy development and are not abused. And then the community development piece, as we talked about before, that's a key part of supporting the development of communities, is supporting families' development within those communities. We'll talk more about that. The family support approach is working with families with a strengths-based perspective to support their healthy growth and development. And then the other uh, section here is about working with families across the life course. So recognizing that we're working with families across their development. So from that comes the unique FRC approach. And wherever FRCs are located, they're working with families in a multi-generational approach. That's another way of thinking about across the lifespan. So they're not only working with adults and their children, they're also working with grandparents, with extended family, with kin family, with whoever is involved in the care and raising of children. They are strengths-based, seeing the families as coming to the table with strengths that we want to support them to further develop, and family centered. Everything we do is centered on the family. They are designed for all families. So, not just for low income families or families facing a lot of challenges, but truly for everyone. So, the image you see on the left comes from New Jersey. New Jersey in the US has 21 counties, and 57 family success centers. That's what they call family resource centers in their state. So those 21 counties in with centers, those include counties that are very affluent as well as counties that are very challenged economically. And the idea is that these centers should be universally accessible for everyone. So regardless of where you live, regardless of what your income is, that all of us could use support as adults with two of the most important roles we could have, being a parent, being a spouse or partner, two of the most important roles that we could have that typically we receive nothing in the way of support or guidance for. So here are these centers to help all of us succeed. So that universal aspect of the center's accessibility is really key in terms of reducing stigma, that these would be seen as something everyone could benefit from. They provide services at no or low cost for participants and support families to build protective factors. So, protective factors such as these. So, these protective factors come from a national organization in the US called the Center for the Study of Social Policy. And what the for the Study of Social Policy did was in 2005 had conducted research that looked into were there certain factors that, when present, were more likely to indicate a family was healthy and strong and less likely to experience child abuse and neglect. And they were able to determine that indeed there were certain factors, these five factors that make a difference. Parental resilience is one of those. That's the ability to weather the challenges of parenting. Social connections is being connected with other people, having that support that comes from uh, being in community. Next is concrete support in times of need, which is being able to access basic resources such as housing and clothing and food when you need it. Next is knowledge of parenting and child development. As we all know, children don't come with instruction manuals. So ensuring that parents and caregivers have the information they need to know what to expect and support their children's healthy development can go a long way to reducing the likelihood of child abuse. And finally, social emotional competence of children, which has to do with ensuring that children are able to express themselves well and connect well with others. So these are the 5 factors. You can learn a lot more about them from the CSSP website, which is indicated there. So as long as we're going to be working with families, we want to be supporting them to build these 5 protective factors because we know based on research that these are the ones that make a difference in terms of ensuring families are healthy and strong. Family resource centers bring together different kinds of supports and services that you may be well familiar with already. So, different kinds of programs such as home visiting or parenting education, health screenings, childcare resource and referral, play groups, fatherhood programs, family counseling, food banks, job skills training bring together multiple supports and services, bundling them in one convenient hub of a location that's easy for families to access. Now, not all family resource centers may have all these circles around the center, but this gives you an example, an idea of the kinds of different supports and services that you may find there, and others as well. And why I say and others as well is because it's important to understand that family resource centers are of, by, and for the communities served. So we don't just plunk down a center in a neighborhood and hope that families come. The centers are developed with the community at the table in the first place. So families are engaged in helping to plan the program in terms of you see here an example of a community needs assessment being conducted, this one in San Francisco, California, surveying families about what are their hopes, what are their challenges, what do they think are the opportunities in the community, what are things they want to focus on that a center could help with. So the programs and services are going to be shaped to then reflect that. Staff are hired who represent the community, who have the same lived experiences, speak the same languages, look like the community serves. That goes a long way to establishing the authenticity and relevance of the centers to supporting communities to succeed. And also, centers are guided by parent advisory committees. So, parent advisory committees are made up of parents and caregivers in the program who then continue to provide support and advise the program on ensuring it's accountable to the community and achieving the outcomes that it's set out to on an ongoing basis. So, this helps root the center deeply in the community. So we often say that if you've seen one family resource center, you've seen one family resource center. Because they're so grounded in the community, what the needs and opportunities look like will differ from community to community. But we also know that based on research that was conducted with the support of the Robert Wood Johnson Foundation in 2015, 2016, that there's also remarkable commonality across the most common service areas of family resource centers. So it's these 4 areas you see here. First is parenting support. So parenting support exists along a continuum from lighter touch to more intensive services. So lighter touch starts with things such as parenting workshops, one-time opportunities to learn about a particular topic that parents may be interested in, such as positive discipline or sibling relations. Further down, parent support groups. So, parents and caregivers coming together on an ongoing basis to share about the joys and challenges of raising children. Next, parenting education series, typically using an evidence-based curriculum. This is very, very, very commonly provided at family resource centers. And home visiting. So, in different places that have programs that are established, whether with health departments or others who go out and visit families in the home. That service is very often connected with family resource centers, such as the home visitors being based at the FRC, which is really wise because number one, it gives the worker visiting the family the resources of a whole center behind them, as well as it also creates an opportunity to introduce the families to the center, because we can't build that protective factor of social connections only through that one-on-one visit of the health worker and the home visitor and the family. We really need to connect them with other families. So that's unlikely to happen in their home or apartment. So having a physical place, a family resource center, where you can bring the families together for opportunities to connect, support groups, play groups, different kinds of activities, that's going to go a long way to building that protective factor of social connections. The next most common service area is access to resources, which again exists on a continuum from lighter touch to more intensive services, starting with what we call enhanced information and referral. So, not just pointing families in the right direction, but ensuring that they have a live handoff if possible and following up to make sure that they get to that resource. So, that's enhanced information referral. Concrete supports. That's when a center is able to directly provide supports that families might need, such as having a food bank or a clothing bank, resources that families can access right there to support them in a time of need. Also, access to housing rental assistance vouchers is provided at many FRCs. Next is working with families over time to address the family identified goals. In the past, this used to be called case management. We don't call it that anymore because we don't see families as cases to be managed, but we call it family development work. So, working with families to achieve their goals over time. And finally, co-location of resources. So that's when external resources are co-located at the site to make it easier for families to access them. So, for example, in Tennessee, in the US, there are public departments that have outstationed workers at family resource centers for a certain number of days or hours a week so that families can sign up for programs, be screened for different programs right there at the center. And that just makes it so much easier for families instead of having to navigate across town on three different buses with little kids in tow to go to a place that doesn't even have a waiting area that's suitable for your children to be in while you're meeting with your worker. This changes it all up, where the center is right there in your community and it's stroller accessible, and you can go right in there and find out how you can connect with these services and opportunities. The next most common area is activities focused on supporting children's healthy development that are engaging the child, and parent leadership development activities, such as those parent advisory committees that I mentioned earlier that play such a key role in the centers. It's also important to understand that family resource centers are not just a list of services. At their core, at their heart, what's unique about family resource centers is that they build community. So they create those opportunities for peer support where you connect with other parents and caregivers. You build that all important protective factor of social connections. We know that this makes a huge difference in supporting families to succeed and why family resource centers are very popular with families. So you've heard me say a lot about family resource centers. Now we're going to hear from a parent sharing her experience. This is an immigrant parent, Sheila Harwood, who immigrated from Africa to the US and lives in a small community in upstate New York. And she'll share her experience accessing the Family Resource Center in her neighborhood.
People underestimate how challenging it can be of trying to balance parenting and effective parenting, mind you, and not having a space to actually vent and communicate and learn alternate ways of rearing their children. People don't realize it is a support that they need, not once in a while, but like all the time. I could see the excitement, the smiles, It is the same every single time they walk in the door. The staff is so friendly, the space is so inviting. So it gives us an opportunity to just like kind of brush off life and then escape into this space where they could just relax. And it nourishes us, it feeds us, and allows us to just make, take all of that and positive energy and do life regardless of anyone's socioeconomic status, regardless of racial background, educational level, the need is exactly the same. It is a place, a need for a place to be able to sit down with other parents and do life together. And that is something that is so impactful. Once they have that support system in place, it has a ripple effect. And we will glean from that because our communities will thrive. The more support, I mean, it's just, it's like a domino effect.
All right. So she said it so well, summed it up there. So now we have a question for you to respond to in the chat box. So please answer this question in the chat box, which I'll pull up here to see what your responses are, which is, have you seen me? Now that we've described what a family resource center is, a welcoming hub of support for families that provide services that are free or low cost, open to all families. You don't need a referral to go there or have a certain income. Have you seen any programs like this in your communities, in your areas, in your countries? Have you seen any programs like family resource centers? I would love to hear your thoughts in the chat if you have, and where have you seen them? Suzanne in Michigan shared that they're just getting started with FRCs in Michigan. I know that very well, says I know Suzanne, and she has been a champion in state government about ensuring their development.
And I'm not sure if you see that Lucine talked about an initiative in Sierra Leone called Future Leaders Initiative. It sounds like they're developing something similar.
Yes, and Lucienne, that has come up in many times that people are developing something and then they hear about family resource centers and realize, oh, this is actually giving language to what we were thinking about. So um, appreciate that. I heard that Moldova was rolling out new centers. Great, referring to them as family-friendly spaces or family hubs. Again, these centers may have different kinds of names, but it's a similar concept.
In France, it looks like they have maternal and child protective centers.
France has also launched a new program within the last couple of years called Les Maisons, that's specifically for the first 1,000 days. So centers to support parents and caregivers within the first 1,000 days of their children being born, and I'm learning more about that network of centers, which is really exciting.
Interesting in Kenya, Diane said that there are residential care institutions that want to transition into family resource centers.
Great, thank you, Maud, for confirming Les Maisons in France. We have someone from Ireland confirming that FRCs do a lot of good work in Southern Ireland. All right, so we have a mix of folks saying they've seen something like this and people who haven't seen something like this, but there is some interest. I saw the interest from Brazil and love to connect more with you about that um, after this webinar. So thank you for sharing, and we will continue here. Right. So feel free to continue sharing in the chat if you like. I want to turn now to share some of the data that has helped us to share the story of family resource centers as well. So family resource centers have demonstrated remarkable efficacy through multiple external evaluations, and we'll share some of that data with you today. And the full research reports where this data comes from can be found on the International Association's website if you'd like to go into it in more detail, because I know we have some researchers joining us today. So the first data that we're going to look at comes from Alabama. So Alabama in the US has a strong network of family resource centers and has had them for some time, 25 years now. And they commissioned a social return on investment study. And that study showed that for every dollar invested, that the state received $4.93 in immediate and long-term benefits. So basically a 1-to-5 ratio. Then the next piece of data comes from Teller County, Colorado. So Teller County is a semi-rural county outside of Colorado Springs. And they moved to what we call a differential response or alternative response system in 2016. And so what that means is the department, the Human Services Agency, would receive calls for suspected child abuse and neglect. And when they didn't think those calls rose to the level where they were going to open a case, they referred the person who had been called about to the Family Resource Center. So that is the differential response or alternative response. So instead of opening a case when it wasn't needed, making the referral over to the Family Resource Center. And since they started making those referrals to the Family Resource Center, they've seen a 65% drop in the child maltreatment rate. A 65% drop just by referring families on a voluntary basis over to the FRC if they wanted to go. And there's only one FRC in the whole county. And look at this incredible effect. And if we understand family resource centers, this isn't magic why that happens. It happens for two reasons. So first of all, that the majority of calls to child welfare in the US are for suspected neglect. So neglect is different than child abuse. Neglect is not the same as child abuse. So neglect being the withholding of resources from children. And typically it's not that parents and caregivers have resources, they're intentionally withholding from children. They don't have those resources to begin with. So along comes a program called a Family Resource Center. The whole point is ensuring that families have access to resources. So if the families are connected up with a place that can provide access to shelter, that can provide food, that can provide clothing, that can get them on the right track with whatever it is that their family is experiencing as a crisis and help them through it, that's going to make a huge difference. That they'll get what they need and not show up in the child welfare system. And similarly, as we talked about, family resource centers are building those 5 protective factors through the different things that they do, including parenting, support, and education. And as we know, that those 5 protective factors make a huge difference in terms of families being healthy and strengthened and not being in the child welfare system. So all of this makes sense when we understand family resource centers, the incredible power they have to change the landscape, ensuring that families do not end up swept up into a system that no family wants to have anything to do with. And once you're part of, you may never get out of. Thanks to the support of Casey Family Programs, which is a large foundation in the United States that supports foster children and looks at child abuse and neglect, we're able to go further with this data to put dollars and cents to it. So we looked at then Teller County, Colorado, what the savings were to the child welfare system through the use of that Family Resource Center. And then we similarly matched it with an urban community in a more diverse area in Orange County, California, and found even bigger savings because, of course, the services are more expensive in an urban setting typically. So this shows the dollars and cents savings, but again, I would argue the biggest savings are the human cost savings, the children and families who will not be swept up into the child welfare system needlessly because all what they needed were resources and access to support. This data also comes from Colorado, and Colorado looked at the centers across the state and researched them over time and saw that families who participated in the centers demonstrated statistically significant improvements in multiple domains, including economic self-sufficiency, health, social support, family functioning and resilience, and caregiver and child nurturing and attachment as some examples. So all good things. Also important to mention in the telling the story of family resource centers in recent years, that family resource centers were in a critical point in the during the pandemic and with the pandemic response. So during the pandemic, of course, it affected all of us all around the world, and families were particularly impacted. And two of the things that families were most looking for support with were parental stress, because your kids were with you 24/7, and access to resources. So parental stress and access to resources were two of the things that families were particularly seeking support with. And it so happens that's exactly what family resource centers do. That, as we talked about before, are the bread and butter of any family resource center, big or small, urban or rural, wherever it's located, is parenting support and access to resources. So family resource centers, to their great credit, stepped up during that time. So not only did they not close their doors, they continued to support families, including ensuring that food deliveries would get out, and that there were places where people could pick up infant formula and diapers and all the different things that you couldn't find in the stores, but family resource centers have them, as these images illustrate. Also, and turn to virtual services to ensure that families were connected with each other and were able to weather the challenges of the pandemic. This was remarkable because it really demonstrated to many the great value of FRCs. And of course, they're not only value in times of crisis, but in this time of crisis, they were something that all families could access and find support in. And that really went a long way to the further development and investment in FRCs that we'll talk about in a few more slides ahead. So also want to share this document, this slide, which it talks about the connections between family resource centers and child welfare, knowing that many of you are connected with that world, child protection, as it's called in some places. And this document here illustrates the role of family resource centers working across the span, the continuum of a family's potential involvement in child welfare. So it starts with primary prevention, which is what family resource centers are most known for. That's ensuring those supports, the building of those five protective factors, that families aren't going to enter the child welfare system. And then the second column is differential response or alternative response, like we looked at in that data from Colorado of leveraging the center to provide support for families such that they don't enter the system. Then the next column is when there is an open child welfare case. So this illustrates what's the role of FRCs when there is an open case. Well, let's say a family is referred for parenting classes, that they're mandated to participate in parenting classes. Where do we send the family to those classes? Send them to the Family Resource Center, which is already offering those classes. And the beauty of that is that those classes are offered for everyone. So the parent who's accessing the services because they're mandated to be there, actually, if they don't disclose, nobody knows who's there because they wanted to be voluntarily versus they were mandated to be there. So it reduces the stigma of accessing those supports and services because you're in there with all kinds of families. and that they're not only accessing that support, but because the center offers all kinds of other opportunities and resources, there are so many other things that they might benefit from as well beyond those parenting classes. And by the way, a big one, again, being those social connections that will form from connecting with other participants in the program. Some FRCs are also leveraged for other things with child welfare, such as in San Francisco, centers are leveraged for supervised visitations. So when the child and family have been separated, but they come together for a visitation that's supervised, they actually have that at the FRC. And the same thing is that it reduces the stigma, brings that support into the community, and the family can be connected with other supports and resources at the center. And then finally, the last column is post reunification. So when the parents and children are reunited, then the case may be closed, but there could very well be the ongoing need for supports. And so who's there to provide the wraparound ongoing support? The Family Resource Center is still there, able to support the family to continue on a healthy and stronger path. All right. So want to share this slide, which is the global context for talking about family resource centers that may be of interest to some of you. Back in 2016, the UNICEF and the World Health Organization and a number of other international partners developed 7 strategies for ending violence against children, which is called Inspire. So these are the 7 that are listed that are listed there in the illustration, and the first letter of each spell out Inspire. So based on research. So again, based on research, they determined these strategies are the most effective for ending violence against children, and committed themselves to promoting these 7 strategies and supporting nations to use their toolkits to address them. So from what we've talked about with Family Resource Centers so far, want to look at what is the mapping of this with Family Resource Centers. So you may be thinking already, looking at these, which are the ones that Family Resource Centers have something to do with. So the particular ones here are norms and values is one. So norms, creating the norms around what it is we expect of parents, and how we view parents, how we view families in a society is part of the social norms in a given environment. So why am I talking about this in relation to FRCs is because, as we talked about, if FRCs are universal, if everyone can access them, that goes a long way to reducing the stigma around weathering the challenges and joys of parenting, right? In Massachusetts, which has heavily invested in family resource centers, they launched a campaign some years back called Parenting One Tough Job. And it was a big campaign to educate everyone about how challenging parenting can be, and that we understand that it's challenging. As a society, we understand it's challenging, and here are the resources to help you, linking folks to family resource centers. So FRCs can be part of campaigns to normalize the support for parents with their all-important job of raising the next generation. Family resource centers, of course, provide parent and caregiver support. So very concretely, as we talked about before, the different ways they do that, very much part of that strategy. Income and economic strengthening. So family resource centers are also well positioned to help with supporting families economically. So this is a somewhat newer area of development to some of the things that have been done. And I'll share an example from Arizona. So in Arizona, their child welfare department and human services department did research on what were certain expenditures that families really struggled with. And there have been further research that had been done before showing that for many families, if they have an unanticipated expense of $500, an unanticipated expense of $500 or more, how many families that could just tip in the wrong direction, that then they'd be really struggling. So they did research in their particular state to look at what were those expenses that were likely to lead to big challenges for families. And based on that, they determined that they would create a fund that was available for families to access to support them with those challenges. One of them had to do with car repair. Another had to do with dental care, interestingly enough. And so they created this fund that families could access up to $1,000. And how do they access this fund? They access it through the family resource centers. So you go to your family resource center and you learn about the program, fill out the information, and then you can access the funds through it, which is really smart, again, because you're not just getting that service, but you're also interacting with the staff and getting to know them getting to know you, and they can understand more what's going on with your family and how to connect and support you further, right? Like, what is it that led to this situation that you're in now? Are there things we can help you with or support you with your family strengthening? So that's an example of how FRCs are being creatively leveraged to help with a newer area of focus, which is income and economic strengthening. Another is response and support services. So this has to do with services and supports for families and children once they're already in the child welfare system or child protection system. And we already talked about with that earlier diagram how FRCs have a key role to play there. And then finally, education and life skills. And that's a big part of what FRCs might do is training and providing information, opportunities, education that will help with families' development and their skills. So, for example, the last FRC I directed was working with an immigrant community, and English language skills were a big part of what the community was looking to develop. So we had English classes, and that's a really important life skill to have in terms of being able to navigate the society that these newcomers are in. So, looking at this slide, we now have an understanding how FRCs can play a key role in advancing the Inspire 7 strategies. All right, so we've covered a lot of ground with FRCs, and we're going to pause here to again ask a chat question, which is what did you hear? What resonated most from you about the information we've shared so far? So, what stood out for you? What surprised you? What may have been an aha moment or something you want to explore further? This little cutie here is inviting us to share. What did you hear? What stood out for you? Please type your brief thoughts in the chat.
You know, Andrew, while people are typing, I love that you tied all of this to the Inspire strategies and how FRCs can meet all of these points of intersection along the way. It just really speaks to how powerful these centers are. So thank you for doing that.
Thanks for your insights, Jane. All right, so what stood out for Mohammed was an integrated approach to child protection. For Joanne, it was the research about how successful FRCs are. Catherine was impressed with the diversity of FRCs.
Sean pointed out the reduced contact with CPS and improving parent-child relationships. I totally agree, Sean. Marta, I love it. Prevention, prevention, prevention. I love it.
Appreciated that. Lucien shared that he said, a term hardly used, but as part of all of what you do is supporting the dignity of children and parents. Yes, I'm glad that came through clearly for you, because that's a huge piece of this, right? Is that we're meeting families where they're at and trying to support their healthy development. So that approach of being strengths based, we're not looking down on parents. We're not trying to save them. We're here to support and partner with them, and that approach makes a big difference in terms of the receptivity of communities to participating in FRCs. I think Yamini summed it up perfectly, supporting families to do the most important job. All right, and Amatha is interested in starting an FRC in India. Great, let's talk with you more about that. Okay, thank you for sharing your thoughts. Feel free to keep doing that. Love to hear what you're hearing. And going to turn to the second part of our presentation, which is, now that we've talked about family resource centers, is going one level up further and talking about networks of family resource centers. So this is another key piece of understanding the landscape around the world of these centers, is that it's not just the centers that have come into being, but also people have hit upon the value of connecting them together, so networking them. So first, to define the term of what do we mean by an Family Resource Center, FRC network, and we're talking about two or more centers coming together. So two or more centers coming together, that's the makings of a network right there. And these networks ensure coordinated support for families and the backbone entity to leverage and coordinate the collective impact of their members. And this slide here is also based on that research from 2016, looking at networks across the United States, which again, great diversity of networks doing lots of different things, but also core common functions that could be analyzed across them. The most common functions our networks are increasing the connectedness, coordination, cooperation, and collaboration amongst members, providing training and technical assistance. That's a really common one, is once you get all the centers together, now let's get everyone on the same page with how we're doing quality work, or train folks on particular strategies or services. Next is working on advocacy, policy, and legislation. So systems change, recognizing that collectively FRCs can mobilize much more effectively than one center on its own, and that many of the issues that family resource centers may be seeing with families are actually systemic issues that there should be changes in the society to address. So the centers being able to come together and mobilize and speak to those can be really important. And finally, providing and maintaining a shared data tracking system. That's also a common function amongst networks. And these networks have sprung up at all different levels, at the municipal level, at the state or provincial level, and also at the national level. And we're going to be looking at a couple at the national level in just a moment. First, just to share that there are also different ways networks are organized. So this slide illustrates the types of networks. I mentioned that a network is defined by two or more centers coming together. The way that network is coordinated, it may be volunteer coordinated, so there's no staffing. It's just the center directors coming together out of the goodness of their hearts, serving in volunteer leadership and leading their network work together. It may be coordinated by a funder, a public department, or private foundation. They may be funding the services, funding the centers, but then also intentionally bring them together to function as a network. They may be coordinated by a nonprofit entity, so a nonprofit or an NGO, non-governmental organization, taking on the role of helping to coordinate a network of FRCs within their state, province, nation. or they may be independent entity, so independent nonprofit NGO that's whole function is being a network and bringing the centers together. They may be intermediary, which means that they raise funds and distribute them to their members, or they may be non-intermediary, where they don't do that. So networks come in a lot of different shapes and flavors, as you can see here, but all help ensure the coordination of support to families. And the examples we're looking at, first, Families Canada. So Families Canada is actually one of the older networks. They were established in 1978. And Families Canada has more than 500 members across the nation that provide supports and services for families. And they reach approximately 500,000 families every year. And this image comes from British Columbia, a family resource center there that does a lot of impactful work. And Families Canada, how they support their members, which is the centers, is they help them to meet the evolving needs of families through various kinds of support, such as piloting and adapting and scaling evidence-based practice, developing and disseminating evidence-informed resources, providing professional development, partnering with other organizations to turn knowledge into practice. So a lot of wonderful things happening with the Canadian network. And then another example is the US network. So the US network, which I was fortunate to be part of co-founding back in 2011, it started with 8 states of the 50 across the US, 8 states that had networks of family resource centers. So we decided to come together to network those networks. And that network was also volunteer coordinated for the first 4 years of its existence. And this is what the map looked like in 2011. And I'll show you what the map looks like today. There are now networks of family resource centers in 40 states, plus the District of Columbia, more than 3,000 FRCs working with millions of American families every year. And this dramatic development from the first slide to the second slide here, it was not because suddenly there was a lot of money available from our federal government or national government to open more centers. It was actually through presentations like this. It was through people like Suzanne in Michigan, who's here participating in this webinar, coming to learn about FRCs and saying, why isn't my state green on this map? How can I look at developing centers that families can access? The families of my state are every bit as much deserving of support in this kind of way. And what can we do to make it happen? So as many different people help turn this map green through their commitment to looking at how to invest in these supports and services and make them accessible and create networks of them across their states. And then finally, turning to now the international level, in 2024, so this year, the International Association of Family Support Networks was born. So this brings together the current national networks of centers with the Irish network, Canadian network, the network in England of family hubs, and the US network coming together to learn from, partner with, support each other as now this network of networks. Our mission is to promote international cooperation, exchange, and best practices within the family support field to support children, families, and communities to thrive. And our vision is a world in which every family is thriving and every country has a strong and effective family resource center network. For membership in this network, you just need to have at least 2 centers in your country. So if you can find 2 centers, then you have the makings of a national network and you can join. And you may be at any stage of network development, whether you're just getting started or whether you've been around for some time. We are very new, obviously, so we're in the process of learning which countries currently have networks or maybe thinking about developing networks. And there's just one member per country, so just one network per country as part of our membership. Right, so that's the international network. And here's our contact information. So our QR code and my contact information. Glad to connect with you further beyond today's webinar. On our website, you can sign up and subscribe to our email list. As mentioned, we just got started this year, so there's a lot of new things that will be developing and coming out. And there's uh, content on the website already with the research reports that I mentioned, as well as the links to the other member networks and the resources they provide. So a lot of rich content in this area. So with that, thank you for your engaged participation. I'm going to turn things back over to Jane.
Thank you so much, Andrew. I encourage everyone to scan this QR code. I can't wait to send you the chat log because I know it's hard for you to watch it as you're presenting all the way through. And um, just the comments and the support for FRCs and for what you're personally committed to doing is just been amazing. So I can't wait for you to be able to read that post-webinar. And Andrew, one of the questions that really just keeps coming up is how do we do this? Like, who do we contact? How do we begin? How does the process start? And I know you went through it in your slides, but if somebody in our audience now is interested in having support to do this in their region, I do want to say before Andrew answers that post-webinar, you'll see a Zoom survey pop up. We appreciate you always filling that out. It takes about 2 minutes, but we've added a section where you can put your contact information in if you would like Andrew to contact you, if you have interest in, having support from him to try to answer individual questions for your region or to help you, again, make this process, get it rolling in your particular communities. So that is in the Zoom polling at the end. So Andrew, now I'll let you answer that question.
Sure. So the question about how do we get started? I would say, so it really depends, because are we talking about someone trying to get an individual FRC started in their community? Are we talking about someone trying to get a network of FRCs started or multiple FRCs started within a city or within a state or within a province? Are we talking about trying to get a national network going? So the answers to how we get started or what the process might look like is going to differ depending on the level we're working with and also the landscape. So, who are our potential partners? What's the appetite for this? What are we seeing with data with child welfare in our areas that we can use to tell the story of the need for an alternative approach like this to supporting families to succeed outside of the system? Um, so the simplest thing is just to say, just contact me. So just contact me for now. Just contact me, and I'll make sure to try to point you in the right direction, depending on what you're looking to do, because it is going to be a very customized response, depending on what you're looking to do. The international association, by the way, we're not a funder, so we don't provide resources in terms of funding that we could say, oh, here are some funds to go set up a network. I wish that were the case. That's not the case, but we're happy to talk with you about strategies you might employ for looking at support for developing FRCs or FRC networks. So we also don't go in and set up networks. So we wouldn't go to a country and say, okay, we're going to get a network going in this country. We're always looking for who are the catalysts, as we call them, who are the catalysts, who are the champions, who are willing to take this information and find the right stakeholders, bring them together, and keep talking about this until it happens. And we're happy to help support that, such as having presentations like this. We're happy to do this, happy to do this for free for folks. If you can bring a group of stakeholders together in your area who may be interested to support this, we're happy to support you through helping to educate about about their value and how other folks have made these programs and these networks happen. So the long answer to your question with a very simple endpoint, which is just contact me. So hope to hear from you.
And I will tell you, I think it's a real positive that you don't go into communities and try to set up a center, because what you've told us about the FRCs is they are community driven. They are needs assessment in a particular area. And, that is their gift really to that area, right? Like they're driven by local stakeholders, and they're sometimes grassroots, movements forward. And I think that's, again, why they meet a need of a particular community so well. Well, while we're on the subject of forming an FRC, there's a lot of questions about funding, and if is there an average cost of sustaining an FRC? Is there paid staff? And I know they're all different, which you've, been very clear. But if somebody were curious about the financial investments, both short-term and long-term, any information you can provide on that?
Yes. You said it very well, Holly, because these centers are so varied that you can make a center with very limited resources, or you can invest a lot of resources in a center. So it's kind of a continuum. So, for example, talking about school-based FRCs are typically the least expensive FRCs to get going, because all what you need is a supportive principal, an empty room, and some kind of staff for it. And there you go. You got a center. I first worked in FRCs that were school-based, so I had that experience myself. And school-based FRCs, they're a whole another story in themselves, because typically you're not only focused on supporting the families of the children in the school, but you're also focused on supporting the families of children who are not school age yet, because a critical piece of the work is the school readiness piece. And if we miss those early years, because we're just waiting for them to be in school, we missed all the critical brain development and all of that. So school-based FRCs are another story to talk about. But just to say, in terms of funding, that's one of the easiest ways to get centers going, is to base them in the schools. In the United States, school-based FRCs are very common in rural areas, because they'll say no matter how isolated families are, everybody knows how to get to the school. So that's one example. I think in general, you're looking for developing a center that would have paid staff, that would have professional staff, that we're hiring from the community, people who speak the language and understand the culture and have the similar backgrounds to the families, and we want to value that. We want to ensure that that is compensated. That's a great skill they build, that builds the authenticity of the program, because they're only as strong as their staff. So we want to invest in good staff, and that costs. Typically, you want multiple staff, so that you could do more with programming. But there are also FRCs that only have one staff person, and rely a lot on leveraging volunteers to help with them. And I would also say, just in closing, is that it's also a continuum as you're just getting started. So maybe you start as a group of committed volunteers, then you're able to hire your first staff, then you're able to hire your second staff, and you build it over time. And you want to have that going, so you're not burning folks out. The good news about FRCs is they're not expensive programs. We're not talking about billions of dollars to develop networks of FRCs. Just in general, they're not big ticket items. Families love them. We didn't talk about this in today's webinar, but it's not hard to make the case to elected officials about their value, because the data is awesome, families love them, and they're not expensive. Looking for government support is the most common route for funding FRCs, be that local government or state, provincial government, or federal government. But getting in the ears of decision makers to educate them on the value of, look, I can show you this incredible program that saves so much money and families love. That's a pretty good case to be able to be in a position to make.
That's a great answer. Thank you so much. And it seems like part of the service that Family Resource Centers provide is to connect parents, with local resources that may already exist. So it's not as if all of these basic needs are being met by the Family Resource Center. Part of it is that connectivity, right, to resources that may already exist in the area that parents are unaware of.
Yes. Yes, sometimes it's navigating things like benefits. So, for example, one of the economic downturns that we experienced in the U.S., parents showed up at FRCs asking about unemployment. Like I've never been unemployed before. What is that? How do I navigate that? How do I apply for benefits? What do I do here? And how wonderful to have a welcoming space with staff who understand those systems and can help you navigate them in your language and can help translate things and can make sure you know your rights and yes, connect you with existing benefits, helping to and programs helping to break down barriers and help you access them.
You asked in the chat, different regions of the world, do they have something similar to an FRC? What's it called? What do you have in your area that might be similar? So a question got posed for those areas that had something similar, maybe not quite the same, but can they be linked to FRCs? Can they be linked to an FRC network? Can they be converted to an FRC? Like what do you do if you have something existing that's maybe not quite at the level in FRC? So you're not reinventing something brand new in an area. Is there a way to link and connect?
Yes, yes. The answer, broadly speaking, would be it depends. And once again, give me a call because we can talk about the specific situations. So the idea of leveraging existing spaces or places is very common with FRC development. So, for example, the last FRC I directed was co-located with a childcare program in the U.S., a Head Start program. And this was really, really clever for several reasons. But let me say up front, we were not serving the same families as the childcare center was because the families in the childcare already had the benefits of all these wonderful things through childcare. We were focused on what about the families that don't have access to childcare because of economic issues, et cetera. But we were able to leverage their facility when they closed down for the day. We took over that space and used it for childcare for the children while we were working with the adults and caregivers in the other part of the facility. So we leveraged their space to be able to do our work instead of, oh, we need to find this huge place and build a whole childcare center to watch the kids. Like it was there already and we just leveraged it. That's an example of leveraging an existing program, building on an FRC into a child care or child development center. Um, I think there are many other examples of that. Family resource centers that have been launched in different kinds of settings, such as healthcare settings, where again, medical professionals will recognize there's only so much we can do in our work with families, but there's so much more that they need. Hey, what if we developed a center where we have staff who can support families with those ongoing supports and needs and community building, and let's co-locate it here. So I think there are lots of different things you could think about and talk about in relation to that.
That's a great point to share in low resourced areas, right? It's why not pair, with the existing, establishments or building, in that case, buildings, right? That can be, have co-uses. And that's a great example to share. Um, I think everyone was blown away by the statistic of the 63% reduction in child maltreatment cases. And I mean, that was from one center, one example. Have you done similar assessments of other centers? Have you been able to find data that is similar? And because that's staggering and a great case for any government official to move forward with supporting this.
Yes, yes. There are more data points, more than I shared today. Those research reports you can find on the website, and the more research is done, whenever research is done, we put it there. With the development of the International Association, we're trying to find out if there's been research in other countries around these centers. So I just heard that there's some research that came out on centers in England, the Shore Start centers, or the UK, I should say. I'm eager to get my hands on that and see what data is that in there that we can include. And by the way, the data comes from different angles, right? Because child welfare, child protection, that's one particular kind of thing. But there's also data about, school readiness increasing for families, and parental stress levels going down, and the economic benefits of centers. When these centers do their work well, they support positive outcomes across many domains, as that data from Colorado showed. I think there's other data about the impact on child welfare, and you can find on the website there. One I'll highlight is in Allegheny, Pennsylvania. That's where Pittsburgh is located. They looked at where the centers were. They have 28 centers just in one county. They looked at where the centers were, similarly matching them with similarly economic neighborhoods that didn't have centers, and they found that where there were centers, that there was significant less um, reports of child abuse and neglect, which again, no surprise, if families can access supports and resources, then they're not going to end up in the system. So yeah.
Well, and we are all driven by data, right? It helps drive policy change, helps inform care. But anecdotally, I think we were also blown away on how this protects the integrity of the family. It meets parents where they're at. It's judgment free. I think all of that um, maybe isn't as measurable in a statistic, but again, this program probably more than any that we have seen really um, provides support and meets basic needs for families that want to do parenting right? That want to have functioning households without stress. And, nobody, I think, signs up and wants to be a parent that has neglect or, can't handle the stress and it ends up in abuse. Or so, I think that's just what really pops out from what you do, maybe different than what we've seen in other service providing programs. You shared that chart about the Family Resource Center and Child Welfare collaboration. I'm curious how you engaged like welfare departments
Mm,
and how, they saw the partnership, because that's not always necessarily seen. Um,
yes. Yes, will differ from place to place, but in many places in the US, and this is actually true in Ireland as well, it is the child welfare entity, the department, the system that funds the centers, because that's where the money is in many places. It's in child welfare. And that's a little tricky for different reasons, because you're asking a system to basically try to reduce its footprint by investing upfront in these services not provided by them, provided by the community in the community. So that's can be trickier in different places. Is child welfare really invested in reducing itself in the world? But sometimes it is, and that's where funds come from to help support those services. And then, of course, if they're paying for it, they want to leverage it. So those partnerships just make sense, that they're being fully utilized. I think in other places where child welfare is less aware of what's going on with family resource centers or their value, that's a great educational point, to say, look, we can make your work a lot easier. We could, I mean, imagine reducing the number of cases by 63%. I mean, that's a huge reduction in the level of workforce they need, and their caseloads and everything, by investing in something that's less expensive and really valuable to families up front. But I think there's behind everything, there's a lot of relationship building, right? Like everything's about relationships and helping child welfare leaders to understand this as valuable to them at the end of the day, and most importantly, valuable to families, because everyone in child welfare, no one's here because they want to see ill for families. We all want to see children succeed and families succeed. To see children succeed, we have to see families succeed. So if we put our money where our mouth is to support families to succeed, then we're doing what we really set out to do.
that was very well said. Very well said. So there were some tactical questions as Is there a manual? Is there access to like the family needs assessment that you referenced at the beginning? As a community looks to establish a center, like how much is provided to somebody who would contact you? Like what are there tangible pieces that can help guide the process to establish these centers?
Yes, sure. And part of this also depends on what country someone's reaching out from. Because, for example, if you're reaching out from Canada, there's a whole network in Canada that can support you with that. And in Ireland, same thing. In the US network has a lot of resources that are well developed that are available for free on their website about starting FRCs and sample documents and such. And, encourage people to look to that. So it kind of depends. But if you're coming from a country that's not one of those that already has a network that can support you, we at the international network will happy to be the default and help point you in the direction of what resources are out there. And then over time, we'll have our resources to offer everybody, right? So we're just getting started. So signing up for our email list will help ensure that you're the first to know when we do release new resources, recognizing this is a tall order to get to our vision of FRCs everywhere. That it's a lot of people to help move that, a lot of you to help move that, and a lot of the people to help move that. So we have to make sure you have all the tools and information and support you need to help move that vision forward for our world's children and families.
Well, in the page that will hold the recording, we'll send everyone who registered for this webinar a link to. Your website is on there and some key resources that we shared on that page. But I would encourage people to go to your website because I think there's some really amazing information on there. It's a great site, and that might answer some of these questions as well. But some things about you, I just wanted, people wanted to know like how you first got involved in this, how you got connected, why you're, how it became your passion and your focus. It's kind of interesting always to know how people ended up where they're at.
Sure. To briefly share about that, so I came into family resource centers through behavioral health. So behavioral health, mental health. I got my master's in counseling and then was working in the behavioral health field in California, actually. And the mental health organization, behavioral health organization that I was working for, had received funds to open a family resource center. So they were opening a brand new family resource center. And this organization was actually working with the Asian community, so the Asian community in California, and there's a real high level of stigma around accessing mental health and accessing support and seeking help in the Asian community. And what I saw was that there was a very clear positive difference in terms of how families felt about accessing the family resource center, going to the family resource center versus they felt going to the mental health center downtown. And at the Family Resource Center, we could do so many of the same things. We could do couples counseling and we could support people with parental stress issues and we could talk about domestic violence, but it didn't have the stigma that the mental health center had. It was a welcoming place where you bring your kids and it's warm and inviting and you're meeting, connecting with others. And so that really deeply impressed upon me, wow, if this can make services accessible to a community that wouldn't usually access them, there's something here. And then got involved in directing other family resource centers and then recognized the value of connecting with others to build networks because just really deeply believe that we all achieve more when we're connected. And am very thankful for now having worked in this field with family resource centers, particularly for 23 years, and just with larger and larger groups of stakeholders, such as now all of you at the international level, focused on supporting children and families. So it's been a great journey, and love every minute of it. So that's
Well,
my story with FRCs.
that showed in how well you articulated the centers, but also your true passion and belief in them came through. And those two themes of removing the stigma and that social connectedness has just permeated everything that you've said. And I think, again, that is just such a huge reason why these FRCs are playing such a critical role, and the data is showing how effective they are. And the fact that Andrew is making himself available to the 450 people who registered for the session. Again, the fact that he's willing to support anyone who is interested in really seeking his guidance post-webinar it just speaks volume. That's a tremendous gift that you've given us. So thank you for making yourself accessible to us. And just a reminder, if anyone, I see some emails popping up in the chat. If people would like to be contacted, I'll make sure that Andrew gets a copy of the chat log, but the most efficient way would be to fill out that survey that will ask you for your contact information if you would like Andrew's support. So we'll make sure, again, that we try to get, regardless of where the information was posted, all of it to Andrew. But again, you have his email as well, so I'm sure he is open to you contacting him directly and without going through us, obviously. So Andrew, I think we merged some questions together. I hope that we answered them all. But I guess I'm curious, like key takeaways that you would like to share with us before we sign off.
Holly, you've been so wonderful about summing up everything. I would just add that family resource centers, if I put it in a nutshell, they're just a good idea. They're flexible to work with all kinds of different communities. They are cost effective, not expensive to put together, and they have a track record of success through multiple external evaluations. Families love them, and they reduce child maltreatment.
I love that. I think you need t-shirts that say Family Resource Center is just a good idea. That's, you summed it up. They're effective. They're the right thing to do in communities. So again, overwhelming positivity from everyone who attended today. Thank you so much. Thank you again for making yourself accessible. And again, we appreciate it. I would love to, come back here in a year and we redo this session and you can have that US map all green and the world map all green, and just imagine the incredible impact. I hope everyone can see why we chose this webinar as one of our prevention campaign webinars, because again, based on the staggering statistics, this is the true meaning of prevention, meeting a family where they are and stopping maltreatment and abuse before it starts. So Andrew, thank you so much. Thank you for everyone who attended. This afternoon, you'll receive a follow-up email with the link to the recording, a link to Andrew's presentation slides, and any additional resources. I did put in the chat, many of you shared some amazing resources around parenting and some other, again, great resources in regards to heading off maltreatment and prevention strategies. If you could email those to me at partnerships@ispacan.org, I would love to add them to this page. So Andrew, you'll have access to them as well in case you'd want to reference them at a different point, and then anyone who attended could also access them from the recording page. So again, thank you to everyone. Again, a special shout out to the World Day to End Child Abuse. Thank you for spending your time with us today, and good morning or good night or good afternoon, wherever you are in the world. Andrew, thank you so much.
Thank you.
Goodbye, everyone.